Stand for the pledge, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Just in time.
Good time.
So did everybody have a chance to review the minutes? I need a motion for approval.
So moved. Second.
Second. Any discussion? All in favor? Say
Aye.
Opposed? Motion carries. Not a very heavy lift today, but we're gonna spend a little time with Ching Chang. Let's go through our resolutions first. So resolution 81 is authorizing budgetary modification, Health Department, Article 6 State Aid Incentive Award. Ching Chang, you want to explain that, please?
Okay, yeah. This is, as the title says, this is incentive award, and since 2013 till now, another round 8 is going on, and every year our health department participate the state health department statewide competition. If we good and we can get extra money. If not good, we didn't. So over the past 6 years, we got, and the state measure your baseline. For example, recently was your baseline performance, and after half a year, you improve your baseline, and then compare with other counties. So if you in the top 2 or 3, we get it. This time we got over $40,000. Like past experience, we got this money, and usually yes, fill in the gap, and budget sometimes short of it. For example, like we buy antibiotics, and one antibiotics, the next you will deal with is an antibiotics for syphilis, and 3 years ago probably $98 a dose, now become over $150 a dose.
Mm-hmm.
So this really we are not budgeting usually, so we use this money spent, and also you can see some of money we use for our training our staff. Thank you.
Any motion to discuss?
Second.
Second. Any discussion? All in favor?
Aye.
Opposed? Motion carries. 82, resolution authorizing budgetary modifications, Health Department, preventative biological expenses. You're up again, Matt.
Yeah, this again, this is for budget modification to put the money for antibiotics and for vaccine, and we move some money for flu vaccine for next season. So this will save some country money.
Need a motion for discussion?
So moved.
Second. Any discussion? All in favor, say aye.
Aye.
Opposed? Motion carries. 18.3, resolution authorizing position reclassification, public health assistant, to public health technician.
This is a reclassification request. The reason we want to reclassify this position is because in the past, this position, we have 2 public health specialists handle this rabies, and the rabies is very busy. But if we not reclassify it, and for our staff, their future stuck there, because really we wanted good work here, and we have 2 good workers, very good. They're retired, and but we look forward to new staff coming. We hope yes can give them career led, and after they work for 5 years, they can become sanitarian. And sanitarian after 5 or 10 years becomes senior sanitarian. So this way, maintain our workforce in a reasonable, structured system. So that's why we request. And also, if you look at a dollar sign, and because retired, she worked for county for more than 20 years, and her salary, yes, even we give reclassify a little bit high, but still is a saving for county.
So if you notice on your sheet for the position request, budget form, the position is actually being upgraded. The old salary was 2168. The new person coming in will be 1751. And that's because, as Ching Chang mentioned, the other person's been there so many years, they went through that increase in steps. So for a while, we're saving money.
Yeah, so just to confirm, we are saving the money, but we're still keeping a quality candidate and.
It will be higher quality because for specialists, usually, yes, high school, and for this technician, need a associate degree. So this way, for them, we get better people in the future on down the road, better for county, better for themselves.
Thank you, sir.
And if I may, the technician title allows you to have that person do more.
Yeah.
And it is also on a succession track if you move up.
Yeah.
As vacancies occur, whereas the assistant is a dead-end job. So it doesn't fit into good succession plans.
Thank you. Right, do I have a motion? Let's do a motion first.
Okay, let's
Make
get
a motion.
Motion, I'm ready.
Second, okay. Richard?
Question, Phil, this has to go to, is this CSCA?
Yes.
All right, so this has to go through the list and testing and all that good stuff. She's not. How many people do we have qualifying with?
Oh, I
Could
don't know.
possibly, don't know.
I don't know how many are on the list, no. Or when the next test is gonna be given.
This is the same one from last time that we're talking about, right?
No, this is new. No, the one from last time got tabled at the legislature, so it'll have to be taken off the table. So,
Okay.
Right, we can do it.
We're saving money.
Any other discussion? All in favor, say aye.
Aye.
Opposed? Motion carries. Okay, that ended the resolutions. Floor is yours, Doc. You
Okay.
didn't bring anybody today.
No, I didn't bring because,
That's exactly.
oh yeah, whole department is inundated with this coronavirus, we will talk about it later. And this, annual compliance report, and, you already saw, and we highlighted here, and, our, compliance officer, I put it very briefly, and the compliance officer, her role was, make sure our operation follow, federal and state requirement, and, she's our third compliance officer. And in 2011, I think 2011, we built this position. The reason was because our early intervention mostly get reimbursed from federal government, but had some issue. And set up this position, yes, really save counties money, because make sure we build the federal government correctly, and not after 3-4 years, federal government came back, give me $200,000 or even much more. So this is the reason we set up this position. And since this position set up and annually give report, and I hope yes next month, and we will bring this compliance officer here and talk about of her work. And in the past, yes, our work is very good, and because of this compliance officer work, and I remember about 2 years ago, and the federal government came look at, oh yeah, your error less than 0.5% and skip your 1 or 2 years checking. So this is very effective. And another piece of her work is follow other compliance county state regulation. For example, like incidents report, we need within 48 hours, anything reported to HR and all she handled. And another bigger piece for her work is education. And education is, yes, she frequently pick up other stories from all over the country, and oh, this agency not to follow HIPAA law and fine $1 million, $500,000, $2 million. Remind the people, work carefully, and then annually, yes, set up a training to our staff, not just our health department, all county relevant to HIPAA law, all get trained. So this is her work, this is her report.
What's her name?
Ginny King.
Anybody who does billing back through state or federal government, as I'm well aware, you miss any mark, there's penalties to pay for that.
Yeah.
They will pay, they'll come back and say, well, now you owe us more money because you didn't follow procedure, and the paybacks can be tremendous on some of these things. So having someone who watches this, we have one in the organization I work for, compliance officers, that their job is to make sure that we're staying within those guide rails and moving forward, and nothing gets caught up. Because you certainly don't want to lose that money, or any future funding for that. Okay?
Okay.
Before you go any further, I know you're gonna cover it, but I'm gonna get my word in first.
Okay, go ahead.
The mass distribution drill that took place was phenomenal. It was like watching a beehive. And I don't know if you're familiar with what goes on with that. They have trucks come in with pallets of Girl Scout cookies, and they redistribute them to all the troops. And then they come through with their vehicles and pick everything up. We are a model in the state of New York for this. We had, was there 6 other counties there, Ching Chang?
Yeah,
6 other counties
Yeah.
there observing the way we do this, because they do it with empty boxes, they do it with paper, we do it with an actual hands-on. You know, if you drop it, you break them. If you get it in the wrong place, it doesn't go to the right pod. This county has a system for pods. I think it's PHAD,
POD, point of distribution.
point of distribution, okay. So they got pods, and what happens is if we have an emergency and supplies come in, they go back out very quickly to these pods, and then the communities can go to these pods and pick up supplies, get vaccinations, whatever the health department determines needs to be done. But it's not everybody running into the city of Oswego to get things done. It is distributed across the county. The only part that I thought was quite humorous is they actually have to practice taking something to a pod. And we were standing there watching the county pickup with the emblem. So a lot of the county property with a load of Girl Scout cookies. I don't think anybody got any phone calls. But if anybody did, that's what was going on. They weren't feeding county employees, they were actually delivering to a pod. Okay, so I just want to give you a very
Thank
well
you.
executed, and I know you're gonna lead into coronavirus, and I wanted you to know there is a system in place, and it was phenomenal to watch. You got to watch part of it.
Yeah,
Yes.
I was impressed.
So,
They said there was $150,000 worth of cookies there.
Yeah, thank you, Legislator Karasek, and thank you, Legislator Yuda, and really thank you for coming. And I just add a few words to this program, and then challenging me. These slides, I just got it this morning before I came. And this part, as legislator Karasek said, is really spread, if situation happens, spread over the county and county bigger agency, Navales and OCO and this SUNY Oswego, they are all part spots. So their agency staff and their families, they will take care of. Like last year, SUNY Oswego collaborated with us. We ship this Girl Scouts cookie to their campus health center. And before the truck go to there, and somehow a tree fell. And then yes, their campus police and all help out. It's a community collaboration. It's really very good. And this also not just state and we got national honors. This is considered a potential model practice by nature and presented at the national emergency preparedness conference. Yeah, and so this, yeah, I just have a few slides and thank you. You brought up and let's see how I can quickly talk about this coronavirus. And the coronavirus, this slide just show coronavirus family. Coronavirus, they in their family 7 strains. Like this strain and this strain is just a common cold. And the 5 strain, it's already existed with human being for at least lab tested last century, 1960s. So 2 strain is new. 1 strain is SARS 2003. You may still remember 2003 started in China. And then the second is to start about 10 years later, MRSA, Middle East Emerging Respiratory Syndrome. And this also, it's a very most deadly, 60% death rate, MRSA. And so this time we call Corona COVID-19, and but in the name of virus they call it SARS, COVID-2. I think this really WHO made a good decision because keep the name SARS, because the doctor named this virus SARS, this disease SARS. He passed away because of this disease. He was WHO assignee in Vietnam, and his wife asked him, "You don't go." He said, "No, it's my responsibility. I need to move to Thailand." So when he moved to Thailand, died in field. So this really, I think, WHO did a good job of keeping this name, and for us working public health, really, every time I saw SARS, every time I would remember this Italian doctor. So this is a global quick view and probably updated to the day before yesterday. This status slides. I just got it this morning. This slides last night. The state health commissioner presented at state legislators for $40 million supplemental money they approved. So this is his presentation, and yeah, over these 2 days and some increased. At least I know China confirmed the case over 80,000 cases already, and this is New York City, and over weekend we have first case in Manhattan, and this is a woman back from Iran, and so this is the situation. And another big thing for me is look, yes, encouraging is really the test used to all the tests we collected and sent it to Albany, Wadsworth lab, and then Albany sent it to Atlanta, Georgia for testing. Now, yes, New York State has the capacity to test it. This important update.
That's fast.
Yeah, it's expensive.
Yeah.
And the $3,600 for a test.
Yeah.
So that's why, and they control very tight. And let me off a little bit. And this so far, oh yeah, I prepared and I was a little bit nervous and I forgot it. And this on this sheet, these are updated till this morning. And the 6 confirmed deaths in the United States. And New York, we have first case, and in the whole nation, we have just over 100 cases. And yeah, and these are all most recent. I updated till this morning. And what we have done as in our health department since early, later January, early February, and we start to follow work with the state health department. At that time, the efforts is put at individual containment. Public health, we call it the containment strategy. So-called containment strategy is tracking people. Where are you from? And make sure after you came from some places and isolated for 14 days. So this was our efforts, and stated, yes, have weekly call updated situation at the beginning 2 weeks, and I think almost every day at least one teleconference call, and over weekend once a call, and keep us updated. And at the very beginning, yes, the task sounds very daunting, and I remember first time say, oh yeah, we have 30,000 flights and travelers, and landed at 3 airports in New York, LaGuardia, Newark, and JFK. But this situation quickly down, like every day, 4,000 to now still around 1,000 a day. So in the state, and most of these tracking traveler is at West End, Rochester, and Rochester and Buffalo, and all at the east side, New York, and surrounding counties, and most middle side. And when I sitting phone call, and yes, middle side always very quiet. I think only Onondaga County they raise some question how to follow up. But our plan was conducted, and yes, we need to go to traveler if they come back from China, and we need to go to look at their residential setting, and if their setting is not fit because they one person, one bathroom, and if their apartment or house only one bathroom, yes, we have to move either residents there or either the traveler there out. So we did, and so far, yes, currently we don't have any. And another bigger piece we work at a very early age in our department is work with college, because we worry college is international, a lot of international students, and quite famous for study here, and some program like computer business quite a lot, and also they have exchange visiting scholarships. So we work with them, and college very cooperative, and work with us and give us information, and so this work very, very smooth and look like, yes, so far, nothing happened yet, it's good. And now, yes, travel restriction and the airport screen still going on, but the work is shifted to community mitigation. Yeah, here, this status slides and shifted to at the same time do containments and do mitigation. And we talk about the mitigation, usually, yes, we talk about the pandemic flu. Pandemic flu, yes, I think everybody here remember 2009 and the pandemic flu and came to hit United States, like started, I remember at the time I was in Maine, started like April, May, and went through to the end of the year. So this pandemic we already experienced, it's really, at that time I remember mostly it's, yes, promote a vaccine and protect the people. It's effective. But this coronavirus, we don't have a vaccine. So we will use non-pharmaceutical intervention. I will mention there later. And this is how this community community mitigation will hope to effect. If we don't do anything, this is the dark purple side. If we don't do anything, and the case will come to peak and go quickly. But if we do community intervention, mitigation, use non-pharmaceutical intervention, and we hope we can reduce the cases and push back. This is the time. This is the number of cases. So we hope we can push the time back so we can be better prepared. And from in terms of number of cases, we hope the case will reduce, protect our people. So this non-pharmaceutical intervention try to use this pandemic flu response. Interrupt me if you have a question.
I do.
Okay. Okay.
I'm not worried about dying. If you do, you do. But the thing is this, the terms I hear you use, and I know it's brand new and there's no remedy for it yet.
Yep.
But the word hope you used a lot. And that, maybe I don't have a concept of what hope is. I mean, the third world nations have a hope to improve. Tell me what your medical background tells me.
The hope is I work so diligently on this is really I hope community work together and use community collaboration we can reduce our societal cost, productivity, life, we can reduce, save life, maintain our daily life. And one example still I want to go back 2009, sure, it's a little bit difference, but the principle is the same. At that time we have flu vaccine, and at that time I was in Maine, and I work with school district. Maine have 79 school district, and I work with each of them, and make sure get as many as school children vaccinated. So in the end, yes, Maine, one of two top in the nation, get most school children vaccinated. And this is really, we reduce the cost from this swine flu that year. So here we don't have vaccine, but still we need people work together and, for example, like use individual approach to control. Later slides you will see, and use our community approach and community distancing and reduce the virus active in our community. The principle is the same.
Yeah, I don't know if we've gotten to it yet, but I guess where I'm going with this is, we don't have a vaccine.
Yeah.
How would you know, how are they treating it right now? I mean, if somebody comes down with this, they must be doing something.
No
Nothing.
treatment.
No fluids, no aspirin,
No special treatment, just a symptomatic relief. And so many, last night I saw in Japan, and they use this Japanese, their physician found, and this asthma spray is useful. But on the other side, it makes sense because this virus not to attach your nose, not to attach your throat. When they go to lung, they stick with your lung, and your only lung have this virus receptor. So they frame inflammation in the lung. So spray it and dilate. Put it this way, dilate this
right?
mucus.
Which leads to my next question. How's our supply on those pharmaceuticals?
As I said, this is reported from Japan. It's not scientifically reported.
Okay. So there's nothing,
just the Japanese
Right.
physicians there.
right.
Yeah,
So there's nothing that we could do to be prepared.
we can be prepared.
Besides- well,
We can be prepared.
I know I'm gonna be a pain right in your rear, but.
Yeah.
Here's what the confusion is, maybe I'm just not that bright, but you use the word community collaboration, working together and like this. Well, right over there's a college.
Yeah.
It is part of our community, but it isn't. And this is the thing I have I'm uneasy about, especially when I'm getting on a plane in 10 days. You know, the thing is, we're getting international flights into New York, LaGuardia, Charlotte, whatever the case may be,
Yeah.
and they're coming back up into this area in commuter.
Yeah.
Okay, whether it's a 340 bus or what, it doesn't matter. That person, an international student, can be exposed to it. And chances are, that's how we got over here in the first place, not necessarily a student, but somebody had traveled internationally to areas that are having an issue with that. Now, this person, I know, you don't know because the gestation period on this is rather long.
Yeah.
Now, this person comes, and I'm not picking on anybody, the international people, don't get it. I want them coming here because they spend money. But the thing is, I don't know how you contain this per se. You say with collaboration. I don't know where to go with it, Scott.
Okay, this I can give you example. Last Friday, I got an email from state. Okay, state say Monday 12 o'clock, state health department webinar with all higher education in the state. When I see it, immediately I send it to college and let them arrange. They should have a person listen to this webinar. And yes, at the webinar, state health department clearly say, yes, if your student, you have a student because study abroad program in Italy, in South Korea, in Japan, in Iran, in China, get them back to the States and isolated for 14 days. Then they can normally be active. This is still part of individual containment. If we talk about our collaboration, is really like we work with them and we provide information like this kind of information to them. And also we will work with them 14 days and we will nudging them. Okay, how many students I cannot release here. Okay, how many students you are there, and how many came back, how many they follow your guideline, self-isolation for 14 days. If, for example, yes, Jen Chen is not a student and get out of there, we will be responsible to say, yes, Jen Chen, this is the order, you need to stay in your dorm.
Yeah, but it might be it's too late.
It's not too late.
When the person is exposed.
Yeah.
And the person exposes other people, because it might not, and I'm not picking on you.
Yeah.
This is my concern, because government is, from our level up, is so wicked, it's unbelievable. But the person gets on a plane.
Yeah.
And I'll go back to that situation, because I fly a lot. That plane's not clean, and don't you think it is? Because they just keep them in the air all the time. And that exposure where that person was, that's gonna be in that environment.
Exactly. Sorry, probably today. Very interesting, because you know this cruise ship outside of Japan, and we call it an incubator. And the incubator. And so when I talk with my friend and say, why this situation in a ship is so severe, but so many airplane we fly, very few we hear about it. Some engineers, yes, this is the answer. Okay, this is the answer. This is the answer. An airplane, modern airplane, the air change every hour 6 times when you sit in airplane, and their filter is at the top level. Cruise ship, every day their air inside the air change only once or twice. It's not at the top. That's why when you fly is safe, then you go to boat. This is the answer. Why you frequently fly, you didn't get it, is because plane put the top level equipment there. So sure, I know airplane, the way they do is yes. If you go, you confirm the case, sit at the back, and then leave 3 feet. No, 6 feet, line empty. This is their airplane rule. Yeah. Okay.
Doctor,
Committee.
do we have solid numbers yet as far as the rate of communicability? I mean, I know it's kind of probably varies from area to area due to population, sanitary conditions, but do we have a baseline yet of how communicable this really is?
How communicable is in scientifically they have a number called R0. R0 means R0. If R0 equals 0 means this is not contaminated. If R0 larger than 1 means you will contain more than 1 person. If less than 1 means this, if we look at this curve, it's already on downtrend. So this disease, because it's still going on, and the scientific estimate is at the beginning says it's 2 to 3. Now they say it's between 1 to 2. But still, I would say probably 2. This means if I get infective and I potentially spread it to 2 people. 2 people spread it to another 4 people. So this is how. And this morning I read some doctors say they expect that 70% of the population will get this virus, but most 80% of people no symptom or slightly symptomatic. 15 to 20% they have symptoms, and the death rate so far look at probably 1 to 2%. Flu death rate associated with death is 0.6%.
Thank you.
Doing great.
So we can discuss, and this non-pharmaceutical pharmaceutical intervention. Okay, and talk about this community collaboration. Still, here I want to go back is really, if, for example, if some situation happen in SUNY Oswego, we can work with them and ask them, yes, whether professor not to give lecture in the lecture hall and put this online give lecture, like these kind of things we can do. So this is non-pharmaceutical intervention, and actually in our this pandemic flu plan, and we already included there. It's not that we just use vaccine to against the flu. Also, this kind of non-pharmaceutical intervention is part of our plan. It's already. Why not go?
It's got a virus.
Yeah. Then yes, if we look at the non-pharmaceutical intervention and yeah, we have personal intervention, community intervention, and the environmental intervention. If we look at the personal intervention, is really yes, put here, and we will encourage people voluntary isolation at home. If you travel back from outside, some places now 5 countries: South Korea, Japan, China, Iran, and Italy, and so voluntary home isolation for 14 days, and respiratory etiquette, and this this picture was wrong. Don't use your hand, and at least use a tissue, or the best is put it to your elbow, and hand hygiene is very, very important, and frequently wash hands. Frequently wash your hands. So this mask is, when you see movie, you always see yes, Japanese, Korea, Chinese. On the street, everybody put it there. But yes, in our nation, our recommendation is yes. This mask for only you have symptoms, you're sick, and for general daily life, you don't need it. This is yes.
So those are for the sick people,
For the sick people,
not the healthy people.
not the healthy.
Unless you're caring for somebody that's already sick.
Yeah.
And you're providing personal care.
So this personal.
Kind you buy the stores, no?
Oh yeah, it's already short of supply some places.
Especially Renfield.
Might keep sawdust out of your
Yeah. It's already. But talk about this really. Talk about the masks, and when we heard immediately, we look at how many N95 we had. N95 is a face mask, but they call it a respirator for our nurse. Our nurse needed it, and this really it's a community collaboration. When we found that no, we don't have, because most of our expired last year October, so we have only about 20, not enough, and so we immediately contact the hospital. Hospital gave us some, then we order some. So this really community collaboration. So community collaboration here, or community intervention, you can see school closure, school dismiss, and this sure it's in the line whether we use it. It depends, but when it happens, really, the state health department will work with the state health education department, and we will follow their guideline. Because not to this point yet, and I know early February, and when we sit and listen to state health department webinar, and it was very clearly, if you want to dismiss a student, you should let the local health department know. So this we will work together.
Doc, who pulls the trigger on this? So if you've got a school that's got 3 kids that are diagnosed as having the virus. And the school, are they the ones that pull the trigger on it, or does somebody else say, nope, that's enough, we're shutting the school down?
And I don't know this situation, how it goes in New York State. When I work in Maine at that time, 2009, give school a line. If your absenteeism more than 15%, dismiss your school and report it to health department. 15% was a line. And you don't need to say, oh, this is 10% the student is respiratory, 5% is GI symptoms. No, disregard. Even some 15% of student is just no reason go away, still dismiss your school.
Well, and I understand that for a guideline there, but obviously the guidelines for this, I mean, the flu, you can transmit that, but I just read that this is active for 9 days. So if you've got a school that's got 5 or 6 kids out, to me, you're probably over the line at that point. So I don't know as though I have any concerns, we're not at that level, but I guess my question is, are we depending on the Department of Education to do that? Are we depending on the local school to do that? Do you do that? We give it to Phil.
Okay, I will call Phil. No, seriously, in this situation, I will follow state health department, because state health, community not to this stage yet, just at the individual isolation, yes, state health department gave school guideline. Your student, your situation, work with the county health department.
So because it's become pretty clear that this isn't a case of we're going to avoid it. It's a case of when it actually comes into our community, how severe, and what our reactions are to that. And our reactions aren't going to be the same as Onondaga County, because people will tend to say, well, you're more rural, you don't have as much, direct on contact. But when you've got certain work environments, college, two of them, and the schools, we can jump pretty quick. So I just want to make sure that there is somebody who, is in that missile silo that knows it's time to push the button and not hesitate and say.
I'm glad you brought that up, but just to interject here, just that you know that I've had a couple departments ask me what's their protocol if we get one in the county. So I've called a meeting of those departments that might have a role or responsibility in this Friday, and we're gonna go over what the procedures are, but also identify gaps in knowledge to get those questions answered. So that's gonna happen Friday. The other thing we're gonna talk about is, there's a protocol for what happens if there's something in the community, but we also have to protocol if we have an employee and it's in our buildings.
Right.
So that we're going to go over, and also how we communicate with our employees and how we best keep all of you up to date, not just the committee, but the full legislature. So that's something that's occurring Friday. It's an internal meeting of the department heads and Jen Ching and myself to get this all planned out. The pandemic flu plan is the model for this, so a lot of the work is done. What do we have to do to adjust to this particular incident? More directly to your question, you identified something that I'm not sure about, but my inclination is that state health could come in and tell that school to shut down. Or one thing a lot of legislators don't know, that on instances regarding public health, the Board of Health of the county has more power and authority than the legislature does, and the Board of Health could come in and act as well.
Which is why I told Chris I need to be at your meeting, because I'm vice chair of the Board of Health.
Okay, there you go.
Is the health department planning on give some information to the residents in the whole county? Like put it in the paper, this is what we recommend you do at this time, or wash your hands, and give the public we're all concerned, but there's 100 and some thousand people out there have no idea what's going on.
We've already started doing that through social media, and Jen Ching and I are working on something that can go out to the employees, and we can do press releases with it as well.
Yeah, we already, and because I think probably 3 weeks ago, we sent out and put it nicely, just to say, keep your personal hygiene and like treat like a flu. But yes, when things escalate, we can send another public announcement. Yes.
Because the schools integrate with each other all the time. My grandson's wrestling tonight. He schools Pulaski, but he's wrestling in Phoenix. There'd be 5 other schools there tonight wrestling. And that's pretty close contact with kids out on the mat. So it could go pretty quickly if we don't think about that.
And that's a perfect example of what that community collaboration is the health department providing the information to the schools using it amongst themselves and with their staff.
And also, we already have weekly updates to healthcare provider, to school nurses, and it's already underway.
Okay.
I believe individual preventive protocols have been announced on every news channel for the last, since this outbreak. Every day, almost every hour, somebody comes on and starts talking about it. So it's not like they shouldn't be aware of whatever else that the county's been telling.
under a rock.
Right.
They shouldn't be, but a lot of people don't.
Well,
TV
I mean,
every day or don't have.
no, I
newspaper,
agree.
Don't have the internet in their house.
Well,
I don't know anybody without television though.
and I don't think we need to go as far as the Post Standard did and say, oh, by the way, here's your shopping list of what you should go buy right now. In your house.
Punk in your house in that 3 weeks.
Actually, I did see a news report looking at
Yeah, they're starting to say, well, I understand there was some panic buying in New York City yesterday and this morning that, people are.
It's likely they'll be hit first.
Another community, we go to community level is really, yes, social distancing. And the social distancing, it's also related to community collaboration. And since I came here, it never happened. When I work in Maine, two events I really cannot forget. One is close churches Sunday services because whooping cough. And at the beginning, yes, say whether we can go. We say yes. Our recommendation, you don't keep it because we give you data. These are evidence, and in your school district, this is evidence, and you make your final decision. I still remember like this talk about 4 or 5 days, and eventually say, oh yeah, I listen to you. No service in the following 2 weeks. Another I remember social distance also related to whooping cough was I literally saw students cry because their high school graduates and principal, this was a private school, principal stand up outside, you in, you in, you out, you out. These students really cry. So this really need community collaboration, and we need to convince the superintendent, principal, and these kids. Yes, you can run your plan, but these kids need to get out. So it's tough task, but we can do it. Environment cleaning, environment non-intervention. So this is I can quickly, yeah, this already, I think, already updated, and we mostly I reported to you is, as I said, we participate in preparation for individual isolation, and we participated, and we put the public education there, and in addition to PR, and we send out our updates to healthcare provider, and this morning I also send it to city mayor, and if anyone have contacted we have 22 village and towns, and it gave me superintendent their supervisors contact the association, and I will forward it to them. Anyway, we need to get people get ready. And yes, as I said, we already close work with healthcare provider, colleges, and internal agencies. And I want to say EMS very helpful, and we order some N95, but only medium size without small size, and EMO office immediately contact the state, and the state. I haven't follow up, but at least I know it's in the order.
Man, senior citizen home seems to be that they're the most impacted as senior citizens, right? Likely to die. Have we made any extra effort to get these places like St. Luke's and Bishop Commons, and has word spread to them on a particular protocol to take?
Yes, this because when we send out our this updates, and healthcare providers in the county, they all get it. And yes, I was told that this hit 600 individual agencies in the county. But let me tell you the truth is, on this side is people don't read it. We have inundated the call, and our nurse came to me and said, everything we put there, and it's more than a week. They never read. So still they have question, ask you, oh yeah, I have a patient fly back, and how I handle it. No, you go to CDC, this already there for if not for days, already for weeks. No, they call us. So yeah, this is the challenge, and we have increased the cost. Yeah. So this is a topic about coronavirus, and can we change it some a little bit light topic? Just to try to entertain you. And let me, because most of you are new to committee, and let me report to you our department and what we have done. Okay, and the sheet you have is every year our department does it, and accumulate, yes, what we have done, and I quantify the numbers and what we have done and put it together. And but I want to combine with our organization chart and give you one by one, give you some information. And first, our county health department. In the New York State local health department, two kinds of departments. One is called full service department. The other is a partial service department. The advantage of a full service health department is every year we get $650,000. After $650,000, we can get 36% reimbursement. So if you look at our department budget, yes, our budget is big, but more than 70% of budget you give to our department, more than 70% go to child early intervention. You need to go to state and ask the state reduce our county local burden on early intervention, because state mandated to have early intervention, but the burden put on the county, not state, not to pick up. So go back, and full service agency, we need to provide preventive services, include STD, TB, and immunization. This is our responsibility. Environment health, we need to enforce state regulations. And also we need to do emergency preparedness. Mr. Karasek already mentioned. So these are our tasks. If you ask me, if not a full service, state give our county, we don't know how much, but we guess probably every year less than $200,000. Okay, because if we not follow state rule, not a full service, and they just are based on population, give you money. That's it. So this is new, and we try to do it for many years, and last year we did it, and we based on we are a full service county, and we set up our mission, our vision, and our core value. And I hope yes you can monitor our activity and guide us how to reach our goals and make everyone in the county healthy, productive, and happy. This is the structure, and yes, here it's me, and three on top of me, and Phil, you legislators, and the Board of Health. Board of Health, yes. When we revise the next time, we will put it here, and we have these we have these divisions. Our parallel with me is medical director, Dr. Lepke. Christina Lepke. She practices in Oswego City and next to the fort. And we have compliance officer, and just to give you the report here, and we have preventive, we have environment and early intervention. And I don't have the number there, and but I can yes proudly say thank you. Yes, our environment volume is unbelievable, and really people work very hard, and our staff. I put this number here, and mosquito is our biggest thing. Mosquito every year is the biggest thing. This I think you all know, and because we just live next to this infamous swamp, and it's early, just before I came here already, about the mosquito question already here. Okay, I got an email and asking about the mosquito spray. So I'm not going to read these numbers, but you can see our volume, and mostly yes. Mosquito enforcement, and make sure all food service agency follow the law. Food agency, not just the restaurant, also school cafeteria, also like the OCO. This Meal on Wheel program, their processed food, we all cover. Okay, and also we cover, make sure summer children camp, we need to supervise. So this is environment health. Prevention, and the prevention you can see, yeah, and we have every year I see increase, but this year, first time I saw decrease is our disease investigation. Last year 2018, over 800 cases. This time below 800 cases. And this job is really, we have a very capable nurse. I always give her title nurse epidemiologist, and ask her, this disease investigation is very, very difficult, because now we talk about 3 years ago. One STD case have 50 close contacts, so she needs to go through one by one. It's really, really crazy situation, and it's a lot of work. And we have hospice. Hospice, our hospice is really in recent years in the turnaround from red to black, and the service very good. And later you can see they got awarded last year. Our service satisfaction is at the top 20% in the nation. So, children with special needs, this is what I said, early intervention, and more than 70% of money you give out to our department spend there. This is state requirement, but the county bear the burden. Okay. And the Healthy Family is a new program. The reason Healthy Family we put here into the county is because, since I came here, I heard a lot, they give a phrase called generational poverty. Generational poverty. So this health is not go back and the latest slides you will see, and health is not just you have insurance, you have doctor, you get health. There's so many social effects. And in our county, we have high child abuse rate. So that's health family program is for building, try to build child and the parents bond and prevent, reduce child maltreatment. So this is, and every time when I talk about it, I always want to give some credit, a lot of credit to our administration and the finance. Our senior accountant and our principal accountant went to accountants, and they work very hard, and I put their achievement there. And last year we got 5-6 grants, and this really their extra job, and make plan and spend the money. So all this I put there. And you can see, we got another award, yes, I forgot. In addition to county hospice, we are top 20 in the nation, and the health department got award for immunization intervention. And story of impacts, I just cite a few and compliments. Like environment health, we put two here, and the first is credited to our public health engineer, and he worked with public water system, and they give. The second compliment is for our mosquito aerospray. Every year, this aerospray, always we can listen to at the same time two different voice. Do it, don't do it, don't do it, do it. But this compliment from a beekeeper, and yes, thanks for our support, because our spraying this airplane use just GPS system, and if we want to spray the whole desk, this area, and your beekeeper or your organic farmer is in this place, and he can switch it off when airplane fly over your place, but no chemical drop on your property. So that's they give us things. And preventive service, yes, this we have many give us compliments, and just to put one, our nurse, yes, I'm not going to read it, in the hospice, Healthy Family, they all. So this is our structure, and yeah.
One question I got, I asked the social services too. We got a community, a lot of young kids in it now, and it's the Amish families.
Yeah.
There's at least 400 on our side of the county on the east side.
Yeah.
Do they get the medicines they need to prevent all these diseases that are mandatory in the schools? Now, I know some kids, you can't go to school without your shots. And they teach their kids at home. They have their own little schools.
Yeah.
Is there anybody, whether it's social service or the health department, is there anybody there monitoring those young little kids and make sure that they have the shots and everything else?
We try very hard to reach this community, but very difficult,
It is.
very difficult. And state came to our county last year, last late spring before summer started, and audit our county's immunization records, but not Amish community. What last year we were successful was because this triple E, we need to prevent them, and we work with Dr. Sullivan in Pulaski.
Right.
Dr. Sullivan, yes, helped to deliver mosquito prevention information to them. It's really, really hard, and every year when mosquito season, yes, we have our staff and personal relationship delivered to some of Amish, and Dr. Sullivan probably reach more people through their elders. But honestly, we don't know how many kids they're vaccinated.
And their horses, they barely sell any of the horses get any kind of shots. And I know my daughter-in-law is a big-time horse person, and she don't even want them on their property because their horses don't get the shots that they're supposed to have.
Yeah.
And their horses are up and down the road all the time, and I think there's close to over 400 families in Williamstown, Albion, Orwell, and Sandy Creek, and Richland, and Mexico. I mean, there's a lot of young kids on that road.
Yeah, and when time comes, and I this is in my plan, and I will stop by to talk with Dr. Sullivan, and yeah, I will try to keep this, because I came here 6 years, no, almost 7, 8 years, and try to reach them was very, very difficult. And before summer, I'm going to stop by Dr. Sullivan's office and discuss it with him to see how we can reach them. This is, and immunization, triple E horse, and human.
Well, I'm concerned about the little kids because they should have the same protection as my grandkids or anybody else's kid.
Yep.
That's my concern.
But on this side, I want to say is, if some horse not vaccinated is an advantage for public health, because before this triple E vaccine for horse, usually 2 weeks after horse situation, human case follows. So in the past, yes, what's the indicator for triple E activity? It's horse in public health surveillance. Yeah. Sure, this, yeah.
A quick question, comment. If you, or it should almost be you because you've got the personality and you're the leader of the, not the leader of the pack, but the county, and I think they'd be more respectful to you. Have you ever reached out, because the Amish do have their own form of government, they do.
Oh, I know.
And the elders, they have certain elders that are just like legislators or anything else that lead those communities. Have you ever tried to reach out to them, because they do meet? They have, like I said, they have their own form of government.
Yeah.
And discuss things with them, try to, and I understand, they're a tough nut to crack, trust me, I understand that. But reach out to that community, because they're a part of us too.
Yeah. This I know we need to reach them. If I knock their door to talk with their elders, their elders will not talk to me. I know this in Maine, the same situation. And that's why this last year when I hooked with Dr. Sullivan, and this time I'm going to go through Dr. Sullivan to reach them, because I believe yes, Dr. Sullivan have substantial connects. This is what we need. In the past, yes, I got something. Oh yeah, I can introduce you. It never realized it. So it's in my to-do list. Yeah. So environment health, and this I just yes listed here, and you can see our different services, and well, one thing I want to put here is our rabies prevention, and this rabies program, our department is they're doing a great job, and they
Yeah, I just have a question on that.
Yeah.
Is there any program at all that can prevent it in the wildlife in the community, or are we just subject to getting our pets vaccinated? Because there seems to be a rampant amount of it in the Minetto, Oswego, Granby area, right in that little pocket. We've had quite a few incidents. And just recently, your office
Yeah.
sent out
the
two.
reason we have two.
We've had some where rabbits, I've shot 4 raccoons since I've been here. And we've had a rabid skunk come into our barn and bite our horses, which the health department wouldn't help because the person didn't get attacked. So we had to go through the Department of Agriculture to get it tested. It turned out it had rabies. But, you know, is there anything that can be done to impact the wildlife community to prevent it that way, other than just making our pets safe?
Yeah, this many years ago, the State Department of Agriculture, they dropped this vaccine for wildlife.
In the May.
Yes, they call baits.
Ban baits.
And this, for some reason, as I know, they didn't do for more than 10 years. When I was in Maine, yes, airplane dropped baits in the woods, and this is effective.
Okay.
This is effective, but yeah,
Okay.
I know in this area, yes, they didn't do for more than 10 years.
Okay.
Yeah, they drop like a small square. So our department, they interview every case, and human exposure, make a recommendation, get shots or not to get shots, and save a lot of county money. And this is, and our on-call, yes, our department, hospice, environment, and health, environment, and the preventive, they all have 24 hours on-call services. Preventive services, this is another list, and we have, yes, this required maternal health, child health, immunization, lead poisoning recently, yes, a state reduced the threshold and give us more workload, and so you can see some program joined with environment health. This is still preventive service, and our health education, you can see a lot of service for prevention, chronic disease, self-management, dental health, and mostly, yes, our public health educators go to senior residential settings, and go to schools. Oh, this is a picture from this our recent drills, you can see, and this, yes, really, I always say this success is county collaboration. In addition to outside, and you can see the place is so clean, and this is a highway, and we have building and the grounds, and behind the IT computer, and all credit is not just the health department, as a county agencies give great support. So this hospice and the children with special needs, we already mentioned. And yeah, if I can, and just talk about the community collaboration, and we already touched, and in our community, our department work with partners and do some programs, some new, some is changing, but this tobacco cessation, it's run already started middle of 2015, close to 5 years, and this is, and the Healthy Highway started 2015, and the piloted into school, and 2018 promoted to all 24 elementary schools, and we have publication here, and this still we have 2 years to go, and it's really educate the kids what is healthy food, what is not so healthy, and this analog food into traffic lights, green light food, red light food, yellow light food. So encourage your kids eat as many as green light food, and sure you can eat like red light food like French fry, but encourage them after you eat a French fry and jump 20 times and do exercise and burn them out. So this kids like it, and also some very interesting was spill over to community, and this was 2018, I think. A 3 years old boy told her mom, say, "Mom, we need to give some green light food to Santa Claus." Was very cute. So this is spill over. And here, this is the Oswego County Trauma-Informed Collaboratives. This is new last year, and really community get together and look at how trauma-informed negatively impact our community, and try to reduce this early child adverse experience.
What does trauma exactly mean? What's the definition of it?
The trauma here is not we talk about the surgical sense of trauma, broken hand or a broken head. Here, trauma we talk about is defined as some experience individually cannot handle it, and impact this individual's emotional capacity, and impact this person's social capacity.
So that would be if they're abused at home and things like that?
Yeah.
All right, so you're working hopefully close with family court on this.
I hope now, yes, start with health and social service agencies, because we need people to identify what is trauma, what is not trauma. Identify it and then help. One of the biggest thing I learned is really like if kids behave out, and it's not blame them, and you go time out, but it's what's happened with you. Whether, yes, this morning you came to school, have breakfast or not. This kind of soft approach, find out what they need and give them. This trauma-informed care, most basic answer. And in the community, we have promoted this called Healthy Miles. And this is a group, and from OCO, from Arise, and from Pulaski Mayor probably he is. And we walk there and testing the trail and make sure this is really, I like it. Collaboration is, yes, make these trails accessible for all ages, all capacities, and all strengths. And sometimes I go to public health meeting and they say, oh, this, we are open, and if you ask, oh, whether you include the disabled and whether the wheelchair can access. Oh, no, but only we, yes, um, work with Arise and this former director there, and we learned a lot. And so this is, and another community collaborative is mobile food pantry, and we have number here. And last year, and somewhere is here, and yes, 1,600 boxes of fresh food, and every time Central New York food bank every month two to three times to our county, and our county big, and east almost the east side of county all we consider a food desert. Food desert we means within 10 miles without a place to get fresh food. All so these food pantry services help most folks on these areas. Sure, close and Fulton, Volney, also covered because their population. And this was last year we had two events, walking trail, and this year we will combine together when time comes, and I will let you know, and hope to see you there at our Trails Day. This year we try to work with tourism office, and multiple week, and every week feature different trails. In our county we have several dozens of trails, and we have a county interactive map, and we're going to feature it, encouraging people being physically active.
Quick question.
Yeah.
Food pantry, or that mobile pantry, is that through the food bank?
Yeah, from food bank. Yes. The Central New York Food Bank in Syracuse.
Because one of the biggest, as a matter of fact, I'll be going there in a couple hours, because I pick up a lot of their bread and stuff and feed it to the cattle and things, because they don't distribute it all. Now, here's a problem that they do have, is distribution, especially in the eastern part of our county, because a lot of places, and I'll use, for example, like in Phoenix, and I know that one pretty well because I was a town board member there for a number of years. And the church did the distribution, and they'd send one of their members in with a pickup truck or van or whatever the case may be. And they would pick up the pallets of this, that, or anything else. And they would take it out and distribute it. The eastern part of the county, we got a real problem, and I know we do, because there's nobody that reaches out and goes, first of all, it's a long drive. If you're going from Redfield down to the food bank down in Baldwinsville, is actually the address over there, town of Van Buren, that's a drive. That's almost a tank of gas. And number one, those people over there don't have the money to put into that. Let's face it. I mean, we gotta be real. Is there any way we can distribute, and the county can't pay for it? I mean, is what it is. Do we have any mechanism where we can reach out to these communities and help get them on board? Because I lived in Parrish for a while, and I know what it's like up there.
Before we put this into the county, and we did a survey, and actually Redfield, they do have a food pantry, and people can get it.
Yeah, but how do they get the food there?
I don't know how they get there, but at least some volunteers working there to get food there. This was our finding. Sure, it's more, close to a year ago. Yeah, they do, and APW and Williamstown and this down this area, and they are big problem. But I want to tell you the other side of problem is we know APW they have needs, but actual attendance to APW is much lower than other place. And almost we went there 3-4 times, and almost every time they brought things back to Syracuse distributed. They food bank don't want to do it. They want to bring things there, distribute them. So this is the challenge, and I know APW school district are very helpful. They always help to distribute information. People there, yes, transportation is a big problem for them.
But this mobile pantry, I've been to a couple of them, and he's absolutely correct. There are some of them that you go ahead of time and the truck's coming in 20 minutes and there's 40, 50 people lined up already.
Yeah,
And then there's other locations you go to and the truck is sitting there and there's 5 people in line.
Yeah.
And you know, the community gets frustrated with it because they're saying, look, we told everybody, you know, no questions asked, come, you know, sign the form, tell us how many people, and take the food. And the food is phenomenal. I mean, and the guy that works that truck is an unbelievable, he's worth videotaping. He really is.
you really.
He's got an unbelievable, great attitude and interactive.
Yeah.
It'll wear you out if you go work one of these things and you're at a busy location, but he's right. I mean, they're not going to come to locations that they want that truck to be empty. It's not about, well, we got rid of half of it, we feel pretty good about it. They went through the efforts of loading that thing, they don't want to take it back. And
Yeah.
you do that a couple of times and then they become reluctant to. And that's a community-based issue because, you know, the health department does a great job of putting this out. And like he said, APW schools got involved. Did it get better after the schools tried to help, or did it stay about the same?
I think it's still the same. The reason is really traffic is a bigger problem for this area. Sure, other problems there too. But yes, the school district was very helpful. Every time, yes, they helped to promote. And like, yes, if you ask them, they will tell you, oh yeah, I learned from my kids' backpack, or I heard from my neighbor, but we cannot distribute. But the other place like Baldwinsville and Bowen's Corner. Bowen's Corner, and no, we started 3 o'clock, 1:30, 2 o'clock, people started the line there. Even snowing, they started.
Pennaville.
Yeah.
Pennaville was that way too. I went to
Bowen's Corner.
yeah, but we did one in Pennaville a couple
Yeah,
of years ago.
Pennaville, yes.
And that one they were all lined up.
Yeah. So this, yes. And yeah, and this I already said, so we more look at health is not a health issue, it's a social determinants of health. I hope this last slide, I know I can keep talking, but I hope this will stop here. And just to let you know, because next month you can grill me, okay? But I give you a heads up. This is county health ranking and started 2010. And this for 10 years, and you can see last year was the best year, 2019, and none of them at the bottom 3, okay? This is county health ranking, and just to put it, in New York State, we have 62 counties, okay? And you can see many times, sure, I came here 2012, I should take responsibility, and it's terrible performance, and until last year, first time. And I hope this year, March, I will come, no, probably April, yeah, they publish usually middle or end of March. And I will come to you and report it to you, and hope still keep this trend, okay? And we can talk about it detail later, but don't grill me too much. That's it.
Very good.
Move to adjourn?
Anybody have anything else?
Oh, I have more, but I stop here.
Next week.
Excluding you. I need the appropriate motion, please.
Motion adjourned.
Second.
Favor?
Aye.
Thank you.